Hi, welcome back to another video. In this video, I am going to talk about trichogram and its importance. Also, how to interpret. This test should be done if your patient have alopecia, to rule out self-induced alopecia, to differentiate alopecia from normal hair loss from abnormal hair loss. When you suspect dermatophytosis, color dilution alopecia, and an alternate test instead of deep skin scraping in diagnosing demodex mites. So to evaluate your patient's hair, you need to pluck hair from different areas all over the body wherever you see alopecia, and then you collect it in this airtight container and submit it to the laboratory. Take a small pinch of hair and place it in the cover slip and add mineral oil to examine it under microscope. I have already done that. Now I am going to put the cover slip to examine. Under microscopy, you are going to see only two types of hairs. One is anagen and another one is telogen hair. Anagen hairs are the ones whose hair roots are rounded or they are bent like this. The borders are often smooth and they are pigmented. So telogen hairs are lancet shaped and they lack pigment. The base of the hair will appear like brush or radish to me. If you find a hair with broken tips, it is often associated with pruritus. If the anagen hairs are high, then likelihood of it being endocrinopathy is very less. However, it is not a very sensitive test. You always have another test to rule out all the endocrinopathies and other causes of alopecia. But it has its own uses because you can see dermatophyte spores in the shaft of the hair, demodex mites towards the roots. You can also identify color dilution alopecia. So in this method, you can only see the external surface of the hair, but if you want to see the internal surface of the hair, then you probably have to process the hair with 10% potassium hydroxide. So to begin with, keep the hair sample on the glass slide and you need to add potassium hydroxide. And you need to heat the glass slide for 2 to 3 seconds. That's it. So remove the excess potassium hydroxide with the tissue paper and add a cover slip to examine it under microscope. And this is how the hair looks after processing. Do not overheat as your hairs might start to get disintegrated. The second method is very useful in diagnosing dermatophyte infection. So this test is very economical, very easy, and it can be done in simple laboratories and clinical setup. Although this test is not a very confirmatory test, but it always adds some points to your clinical examination. Please try this test in your laboratory and let me know in the comments. I hope this video was informative. I'll see you in another video. Till then, take care and bye.